2017. Reverend Green, can you give us an invocation?
Yes, President Bivens. Good morning, everyone.
Right.
Most gracious and eternal God, it's once again that we have come. We come today, Lord, asking for your blessings. We pray, God, as we gather together here on today, we pray for your guidance as we move forward with our agenda. Pray, God, that you would lead us and continue to guide us in the direction that you would have us to go, and we'll be careful to give your name the praise. We pray, God, that as we move forward, that you would give us the spirit of joy and enthusiasm. Pray for those that are here today, and pray for those who had a desire to be here but could not for some valid reason. We pray, God, that whatever we say and do here today, that it would be well pleasing in your sight. For us in the name of Jesus, we pray. Amen.
Amen.
Thank you, Reverend Green. Gloria, we'll just do a roll call by sight, and so you can see who's on.
I can.
And Shirley Washington will not be here, so she's excused this morning.
That's the only excuse one?
She's the only one to call.
Okay.
All
Thank
right. You want to do the minutes right quick?
Okay, I can do the minutes right then. NACP membership meeting, April 24, 2021. The regular membership meeting was held by Zoom video. This meeting was a forum addressing racism versus equality, police reform. Will there be a shift in policing? The presenters were Chief Eric Johns, Tori Barbara, District Attorney Sheriff Patrick Withrow, Pastor Trina Turner, Faith in the Valley, Bishop Troy Dockery, Greater Christ Temple, Andante Pointer, Civil Rights Attorney. Sheriff Patrick Withrow spoke about the community coming together. 90% of the 10-point plan from Stockton NACP was implemented. Things are moving forward. Policy should be put in place and should be embraced. Recruitment is continuing. Emphasis is placed on hiring people of color. It is hard to get a diversity group to join the department. Chief Eric Johns reflected on the George Floyd verdict. He emphasized that the justice system did work. He talked about relationship, racial reconciliation in the ways they are enforcing the law. They are working closely with the Community Advisory Committee and a review board. Tory Verba DA office is collecting data on family violence. There's a rise in family violence. Individuals that need help need resources to help with trauma. There were 148 resisting arrests without the use of body cameras. 10,000 bench warrants were recalled. Some of the cases are over 10 years. A goal is to implement better practices. Pastor Trina Turner stated that a change in the policies is not being felt by the community. There is a disconnection. Mixed emotions are coming from the people. Race is still an issue. There is a training, moral, and ethics problem with the police department. Some officers are overly aggressive, and there are some that never fired a gun. Adante Ponte, civil rights attorney, stated there are anxiety, anticipation, and collective feelings in the community. Justice was served in the George Floyd trial. We should move forward and be mindful of the history. The police department should retain and evaluate police officers. They should understand their role. Bishop Troy Dockery, Greater Christ Temple, elaborated on the anxiety that most people were feeling for the outcome of the George Floyd trial. This was a small victory that lasts for a moment. Policy and procedures are being developed, and the community is not involved. The community needs positive police interaction. Change is going to come. Do not magnify the negative, focus on the positive. Committee reports. Luana Bivens provided an update on the emergency rental assistance partnership with El Casillo. This assistance is available until 4/30/21. It also covers past due utilities. Adjournment 12:15. This completes my minutes for the membership meeting, April 24, 2021. I move that my minutes be accepted as read. Can I get a second?
Evan
Second.
Wade, second.
Thank you.
Okay, we've had a motion, we've had a second. Are there any questions or issues related to the minutes? Not, all those in favor vote by the sign of aye.
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 Any opposed? Any abstentions? Thank you, Gloria. Motion is carried. Next item is the treasurer's statement. Deborah.
Good morning, everyone. This is Deborah Sullivan, Treasurer. The Treasury reports has been filed and executive members receive a copy. If you want more details, you can contact me by appointment. Thank you.
Okay. Thank you. Thank you, Madam Treasurer. And any member that's wanting to see the standing of the records has the right and the opportunity to call our treasurer at any time and make an appointment with her to review the books. Okay, at this point, I'm going to ask for a motion to forego the regular business until after the presentation.
President Bevis, this is Brandon Thorne. I will request a motion to move past the regular business to the presentations at this time.
Okay, is there a second?
Melissa Barrett, I second.
Okay, it's been moved in second. Any discussion? Hearing none. All those in favor vote by the sign of aye.
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 Okay, thank you very much. We will now move down to the presentation, today's presentation with Dr. Maggie Park and Mr. Chuck, where we at?
Davis.
Yeah, Mr. Chuck Davis. And Dr. Park, I will ask you to introduce yourself briefly, and then I'll ask Mr. Davis to do likewise. And I don't know, I guess you should start out, Maggie, or do you want to have him start out?
No, I'm happy to start off, and I have just a few slides. If I could share my screen, I'll see if I could try, and then Chuck will follow up from where I take off, and then
Okay.
we'll definitely be able to answer any questions. So let's
All right.
see.
You need to be able to share the screen? Okay, all right.
You see it now?
We got it. We got it, President Bevis. We got it.
All right, thank you all. So I'm just going to start off by showing you a snapshot of our data dashboard, and anybody could access this data dashboard if you go to the public health website. But I took the latest snapshot, which was updated yesterday as of 1:23 p.m. You know, and this might be familiar, our epi curve. We had this summertime spike in cases, and then another wave or surge of cases back in the winter time. And we've come down since that surge. We're doing a lot better than what we were doing back in December, but it's not like COVID has gone away completely. We still have COVID in our hospitals, and we still have new cases of COVID being added to this total every day. And the total is now 73,310 confirmed cases since the beginning of this pandemic, with 1,394 deaths. You look at those two curves, and really what follows is the hospitalization curves, which, as Chuck has taught me, whenever you have a spike in cases, a couple weeks later, you're going to see the spike in our hospitals because the transmission rates are increasing, more positive cases, meaning more people are going to end up in the hospital. And so we did have that summertime surge and the wintertime surge. The blue line indicates the number of people in our hospitals with COVID. This red zigzaggedy line is how many people have been in the hospital for any reason altogether. Blue is COVID, and red is people with COVID in our ICUs. And again, it has come down, and we're like in about 50s now. We're across our 7 hospitals in the county, there's maybe 50 people. There's been as low as 31 people in the hospital. It goes up and down a little bit. We always have somewhere in the teens in our ICUs and around 10 still on ventilators. So, you know, we hear about June 15th coming and this blueprint goes away. There will be no more purple, red, orange, yellow tier. Everything's going to open, business as usual. But that doesn't mean that COVID is gone. We still have work to do, and we have variants and other things to worry about. And I really do worry about another little wave happening if we're not careful. So this slide is kind of busy with a lot of numbers, and I don't mean to bore you with numbers, but just like to show it for anyone who's interested. Our most recent numbers that posted are right here on this line, May 11th. So these numbers come out every Tuesday, as you know. And this is what's going away on June 15th, is all this business of whether your county's in red or yellow or whatever. But we just want to show you that we've had testing positivity numbers in the orange for quite some time. We turned red this week, April 6th. But we can't get to orange because our case rate's still stuck in red. This case rate needs to get down to this 2 to 5.9 range. So as low as 5.9 at the most in order for us to move to orange. And we're still not there yet. We kind of had a bump up last week, and then we came back down this week to a case rate of 7.2. And really, you don't need to know these numbers, but just to let you know that the numbers the state tracks are these three columns. This one, and this one. And I'll tell you that I just looked at the state's numbers, and although our case rate 7.2, state's at 3.7. So this county's been above, almost by double most of the time, above the state case rate. This is how many people per 100,000 people in your county had COVID cases for the week that was measured. And so state's at 3.7, state's all the way down at 1.2 or so for testing positivity rate statewide. Countywide, we're at 2.8. So we're kind of at double the state median, and that's the way it's been for quite some time. And if you look, it's really the central part of the state that gets stuck there. And we're always trying to discover why that is. But several reasons for that. Could be our geography, could be our economy. You know, we could go into that. But really, if you look, here we are, we're red, while most other counties are beyond us. They're orange or yellow. They're doing better. So it worries me that June 15th is going to come around. Everything's going to open. There won't be any capacity limitations. CDC is talking about taking your masks off. And in our county, things could go bad because we're just not doing as well as some other parts. Like I said, here we go, 3.7 case rate, 1.2 positivity rate. These are the state's numbers. So one thing, one part of why our case rate's high has to do with vaccinations. Obviously, it's not all vaccinations, but the biggest way to get out of this is to decrease the number of people getting sick, bring down our case rate by decreasing transmission and not having people be so sick. And we do have a means to do that through vaccines. So it's the one thing that we've got the power to kind of do, yet we're not vaccinating at the same rate as the rest of the state also. So you look at the number of doses administered statewide, 33 million, we're almost at 500,000 doses. That means about 210,000 people have received 2 doses, 73,000 people have received at least 1 dose. The state measures the same numbers, and they say, look, add up the 47 percentile and the 15 percentile, a total of about 63 percentile of people in the state have received at least 1 dose of a vaccine, or maybe they got Johnson & Johnson and 1 dose fully vaccinated them, or they've received 2 doses. So 63% of people age 16 and over. We're still using 16 and over. I know that 12-year-olds can get vaccinated now, but the denominator is how many people do you have 16 and over that are vaccinated statewide? 63%. In some counties like San Francisco, they're up to 80%. They're doing really well. Here, we're at about 50. We're at about 50, whereas the rest of the state's an average of 63. So we're doing better than some counties, but doing a lot worse than others, and definitely below the state median. we got some work to do there. And that's why I'm really pleased that Mr. Bivens invited me today again to talk to you all, because this is really a pivotal time where we're going to need as much help as we can get, because we're really facing vaccine hesitancy and vaccine refusals. So this is from the website that the state created that's called Vaccinate All 58. If you go to Vaccinate All 58, you're going to see this lady at the top of the page, and at the bottom you'll see our Surgeon General, Dr. Nadine Burke-Harris, doing a video. So they're called the Darius videos because she talks with this guy named Darius, and they talk through why Darius is hesitant to get vaccinated and why he might not advise his family to get vaccinated. And Dr. Burke-Harris talks with him. You know, I've been tracking Dr. Burke-Harris since before COVID because I'm a pediatrician and because I'm on the first 5 commission here in San Joaquin. So years ago, more than 5-6 years ago, she was renowned as a speaker on ACEs, adverse childhood experiences, and how toxic stress can affect you lifelong. So I've heard her speak, I've heard her do her TED Talks, and of course, she became our first state Surgeon General to deal with those types of things. But of course, as with everything else, she just got brought into the COVID conversation. So she's there to do adverse childhood events and work on toxic stress, socially emotional things, but she's really helping out with the COVID conversation. And I like this website because it kind of tells you about the safety and efficacy of the vaccine and things you might get to do once you're vaccinated. But of course, sometimes this is not enough to convince people. And what I tell people is it's okay to have questions. And when it comes to the African-American community, it's okay to have fear. It's okay to even have anger, because did Tuskegee happen? Yes. Is there racism in healthcare? Yes. There may be deniers, but we know that it's real. And from a public health standpoint, we understand where people are coming from, where they say they don't have trust. But that's where we need people like you who are voices, who are influencers, to be trust messengers, to say, we know where you're coming from. We're not going to deny history, but let's look at this in the current time frame. And let's look at this as something that's offered to you and that is safe and that is effective. And let's not take this chance and lose it. We have heard story after story from our hospitals of young people with children, young children who did not want to take the vaccine and they're sick or they're dying. There was a 35-year-old woman who died, left behind a 2-year-old and a 7-year-old last week. She had not wanted the vaccine. And I just think, what would have happened if she had taken the vaccine? These vaccines that we have are so powerful, and the data shows that they are highly protective against even having to be hospitalized, and 100% protective against deaths. And it doesn't make sense to me that somebody wouldn't want something like that. But that's my point of view. I can scratch my head and think, wow, why wouldn't you want this? But now it's my job to come from a point of understanding and say, okay, you're not me. You have your reasons, and let's explore your reasons. Let's talk about this, because I don't want to judge you. I want to see where you're coming from mentally, and what can I do to get you over the fence? A lot of people were involved in the trials that got Pfizer and Moderna and Johnson & Johnson accepted and approved. In the past, vaccine trials were done on white people and white kids, and they were safe, and then they were approved. But every effort was made to include Asians and African Americans, and there was good representation from the African American community, even in the trials. And we continue to follow everyone who has been vaccinated to date. And I do believe that the FDA and the CDC follow those things very closely and take it very seriously. But we can have those conversations. Now, we did try to have those conversations with some of our community-based organizations. We meet with El Concilio, Mary Magdalene, Apsara, on a monthly basis through our resilient community advisory panel that we put together. And we asked some of these folks, why do you think people aren't getting vaccinated? And these were the answers we got from our own community members. They lack confidence. They don't think COVID-19 is really all that bad. You know, it's not severe, it's just the flu. We don't know who's going to respond to it with no symptoms and who's going to respond to it with a lot of symptoms. We still don't know why some people who seem perfectly healthy end up in the hospital. Concerns about the vaccine was rushed. Warp speed. You know, I wish they didn't use that Operation Warp Speed anymore because it's actually causing distrust. Access to vaccine clinics, transportations and appointments. Worried about the side effects. Yes, they have, you know, we got friends telling friends, oh, it hurt so bad for a couple of days and I was out. But, you know, think about it. Fatigue and pain from having the vaccine is nothing like having the actual disease. And people are afraid of the side effects, but we got to talk to them about how they should really fear having the disease more than the side effects. Taking time off, it's hard. Unknown length of protection. Is it worth it if I'm going to have to get a booster shot in 6 months? So misinformation and vaccine myths. But I really would love to explore this with you further. And after we have a talk with Mr. Davis, I want to come back to these ideas if we have time, Mr. Bivens, because I would like to hear from your community what you think are the barriers. And maybe if you have some real actionable items for me, because we've tried to take it to the communities. We're trying to take the vaccine into neighborhoods. But if you have some real specific ideas of what we can do, we're at a point now where we're listening and we really want to know what you think. And this is my last slide, but what I mean is this. We're shifting to a ground game. This is the Kaiser MassVax hub site at the Stockton Arena, which is already about to close because ain't nobody going. And this worries me. Like, look at how beautiful this is. There were 36 vaccination stations, all these chairs set up for you to wait 15 minutes for your observation. A pharmacy was set up on the side and gurneys in case there was an emergency. Money put into this. It was just beautiful. And I was so excited when this opened because I thought, my goodness, the state's opening up to 50 and over. There's going to be a flood of people. Oh, then we opened up to 16 and over. There's going to be another flood of people. And there just wasn't. We reached a point now where people who really wanted the vaccine and were demanding it, got it. They found a way. And now we're at the point where we need to really reach those people who don't sense any urgency in getting this. They want to wait and see approach, or maybe they're completely anti-vaxxers. We've reached that population now because anybody who wanted it got it. So now we're shifting to this ground game. We're going to take the vaccine to you. We realize this is what we need to do. So this vast vaccine site is closing on the 22nd. Our ag center, the one that was run by the county, not by Kaiser, but by my folks, that's going to really decrease its hours at the ag center because it's just not worth keeping all those nurses and people out there when hardly anyone's showing up. So we know now the game is this. We got to take our educators into the community and talk to people about the vaccine. And we got to be there, right there to follow up with the vaccine. And we got to give away free stuff, food, hand sanitizers, masks. I'm trying to partner with other people and I'm getting grants from the state to do incentives, raffles, ballpark tickets, whatever we need to do to try to incentivize people. But we're going into churches. We're going into schools now because 12 to 15-year-olds are now vaccinatable through with Pfizer. I don't know if that's really a word, vaccinatable. But anyways, we can get to schools and churches and we're talking to businesses. We've been talking to the chambers of commerce, visit stockton.org. We're trying to talk to people to say, hey, you want an event on Miracle Mile, Lincoln Center? And so we're open to doing it this way. And we're at the point where we're not saying you got to bring 200 people in order to make it worth our time. We're willing to get out there and do 30 people, 50 people, because every little bit counts now. We're trying to get on par with the rest of the state And the rush is to try to get there before June 15th, before we open up and we all end up in the hospital again. So that's my talk. I'm going to let Chuck talk now. And then if we have time, Mr. Bivens, I'd love to hear from you all, any ideas you might want to share. So thank you.
Well, would you give us a introduction to Chuck? Or Chuck, you want to introduce yourself to us? I mean, you know you the best. Maggie says you're the greatest. So I figured you have to be super if they're using you, because we have a stress and a strain in using Black folks. So I'm happy to see you. Good morning, brother.
Well, good morning to you, Mr. Bivens, and to everyone else that's on the call. Thank you so much for having me. My only regret is I'm not a Stockton resident or a San Joaquin County resident. I'm just up the road here in Sacramento County, but my wife is a physician in San Joaquin County, and San Joaquin County is basically a second home. First thing I want to do is I want to single out Dr. Park. I mean, she's never going to, give herself accolades. I think that she's always thinking, what more can I do? But the fact of the matter is, from the very beginning of the pandemic, one of the things that Dr. Park did is realize that this was a novel problem. And so how do you deal with that? Well, you apply public health, what you know in public health, you apply epidemiology, but she did something different. She actually said, what I'm going to do is I'm going to look at data science. I'm going to let the science guide me. And so that's what we set about doing from the very beginning. We collected tons and tons of information. My job as a data scientist is to be impartial and dispassionate. My job is to sit and look at all the numbers, all of the data, and figure out what it means. And I'm really, really pleased and excited to be on this call, because what we know historically is that within the African American community, we are disproportionately affected by issues with respect to health, with respect to economics. I mean, the racial, issues manifest themselves in so many different ways in terms of our quality of life. And what's happened with COVID is it's proven it without question in terms of mortality, in terms of hospitalization, in terms of how we're treated with respect to long haul. Do people even believe if a particular person talks about having long haul symptoms? And so Dr. Park, from the very beginning, not only was she looking at this information, but she was absolutely committed to understanding and addressing those disparities. And I will tell you, even though she would probably never say it, that at times it has come at a personal cost. I mean, there have been some unkind comments with some of the focus on focusing on communities of color. But the reason why that was done and why public health can really kind of be looked at almost in a heroic way is we were able to establish, irrefutably looking at the data, that people of color were at greater risk in terms of hospitalization and death. And so Dr. Park really moved the public health department in terms of that focus. And one of the things that the department focused on was something called the HPI, or the Healthy Places Index, which kind of looks at socioeconomic data and a bunch of other factors, but it's where the most disadvantaged areas are, broken down by zip code. And she was absolutely relentless on focusing on that and doing outreach. And so much so that I guess it was earlier this week, Dr. Park was singled out by the state and gave a presentation to all of the public health officers and public health directors, because San Joaquin County, even though we have a higher overall rate, we basically were off the charts in terms of targeting people that were at the greatest risk based on that HPI, that that health equity metric that we're so concerned about. Without question, that has saved lives. These are people that if they didn't get vaccine and if there wasn't a absolute focus on that particular group, people within that group would have succumbed to COVID, either been hospitalized or worse, died. So there's no question about it. Lives have been saved. At the same time, and I guess if I could share my screen, I'll go over a couple of things in terms of who's been vaccinated. Dr. Park talked earlier about the people that wanted vaccine got vaccine. Part of my job in data science is to not just look at who, but really dive into who these people are so that we can figure out how to better target and address them. So if I can share my screen. There we go. And this will be kind of small. I'm just going to point out a couple of things. So this area here is income. So when you get a vaccine, we don't know how much money you make. We don't know what you do for a living. But what we're able to do through data science is we're able to infer a lot of that information. So what I want you to look at is basically this area here, which is green bars, which are income. At the top, that's lower income, and at the bottom, that's higher income. And we also have political ideology, level of education, gender, and whether the person's single or married. So what I'm going to do, I'm going to turn on a filter here, and I'm just going to focus on African Americans. And you'll see that the screen changed quite a bit. So you can see mostly liberal, mostly overwhelmingly Democrat. And these are the people that received the vaccine, so that we know have been vaccinated. But you can see that the income remains very, very high. The median income for San Joaquin County is around $59,000 or so. So it's right about here. And for African Americans, it's a little bit lower. It's here. So in this 45 to 49 range, about $10,000 less. So what this is basically telling us is that, like Dr. Park said, the people that wanted a vaccine got a vaccine. They tended to be highly educated, and they tended to have pretty good incomes. And we can look over here in terms of occupations, a lot of clerical and service workers, but a lot of professional and technical as well, which probably includes nurses and people that are working in the hospitals that got those early vaccines. So this is very, very telling. So I'm going to go to a different view here now and bring up this one. And so this is a little bit different. Let me just get, there we go, here too. So now I'm gonna, so what the other thing that I wanna look at and talk about is, we know that African Americans are not getting, we're not taking advantage of the vaccine to the degree that others are, but a little bit more detail. And this is a little bit simpler to see and understand. So if you were to look, if we break down race and ethnicity self-reported by those that have received the vaccine, you can see whites are at the top of the list, Latino, and then unknown and other race where they didn't specify. We kind of figured out roughly who these people were, but this is just the raw data. And then Asian, and then African Americans near the bottom. So I want to just focus on that group. Something very interesting happens when I do that. This is the age distribution down here from age 16 all the way to age 98. And the pink bars represent women and the blue bars represent men. And then we also have their first and second shots. So there are a couple of things that are going on. Again, as a data scientist, I'll condense all this and just give you the digest of what all this means, because it's easy for me to get into the numbers and stay there all day long because that's what I do. But what this really tells us is that amongst our younger population within the African American community, they're not getting vaccinated. Older people are getting vaccinated, and also within this younger population. And when I say younger population, that's 16 to about 45 years of age or so. Actually, you can extend that out to 52. So I put the cutoff about here. But these are people that are, by and large, they are not getting vaccinated in the numbers that you would want to see. But more importantly, they're also a lot of them are not going back if it's a two-shot. If it's a two-shot regimen like Moderna or Pfizer, as opposed to the Johnson & Johnson, a lot of them are not coming back for the second shot. So, and I don't know why that is. We'd have to probably talk to people and interview people. Is it a matter of transportation? Is it an issue with work where you can't get the time off? Is it that you're afraid that you're going to have the side effects because you've heard that there are some side effects when you get the second shot, and maybe you don't want to take time off from school? I know in some cases, some people have said, well, listen, I can't take the second shot because I've got to take care of my kids, and I can't be sick and laid up in bed for the day, because then who's going to watch them? You do have some protection with the first shot, but it's critical you get the second shot, because there are the potential for breakthrough cases. And so we know that your protection wanes, which is the whole point of getting the second shot a couple of weeks later. So my thinking is that one of the messages that would be critical would be, especially in the African American community, is to let our community know that they need to get vaccine, and they need to get it. We need to focus on people that are younger, because the older people are getting it, and they're following up on their second shot as well, which is somewhat unusual, because it's usually with older Black folks that you have to worry about care. But younger people are hesitant, and those that are getting the shot, and it might be that maybe they're misinformed. Maybe they think that it's like the Johnson & Johnson, that I only need one and I don't need two. They need two. And it's critical. Dr. Park talked about this. I'm of the same opinion. Things look really good now. We suddenly went from wearing masks now to no masks to, I would imagine people probably start to challenge each other as to whether or not they've been vaccinated. That'll be a whole new era that we'll be in, I'm pretty sure. But what's most concerning is that in other places outside of California, like California, we've got pretty good vaccination rates overall. But what we've learned with this pandemic is that this pandemic is really a bunch of little epidemics, and it changes from county to county. It changes from city to city. It literally changes from neighborhood to neighborhood. And so you can't necessarily go by the overall for the state. But outside of the state, we're talking about 35% of the population being fully vaccinated. And if we have variants, and those variants start to take hold, the people that won't have any protection are the people that are most at risk. They're our community. And so, I'm very, very eager to do anything that I can, work with you or anyone else, to figure out how we can effectively message that our younger people within the African American community need to get vaccinated. And not only do they need to get vaccinated, if they have been vaccinated, they need to follow up and get their second shot. And even if they get the second shot much later, that's better than not getting that. And I think I have one more screen I was going to show, and then I'll take questions. Yeah, so this is case data, and it's case data throughout the county. And I'm going to focus on, and this is average age over time. And what I'm going to do is focus on Black folks. Oh, let me turn this on.
Is it possible to make the map a little bit bigger as you're talking about specific areas?
Yeah, I can definitely do that, or better yet, we might, with Dr. Park's permission, I think it'd probably just be easier to make a couple sites and send them out, and then you have them, especially if you're looking at working with other community-based organizations or groups or individuals. That might be helpful to have something that you can refer to that shows the distribution. But the reason I just want to bring this up is this is looking at what COVID did within the Black community within San Joaquin County. And most important thing to look at here would be when these cases came. But what's really important is the average age over time. And we're talking 40, on average, 41 years of age. So COVID early on took out people that were older, that were frail and weak, and in assisted living and skilled nursing facilities. But as time went on and the virus adapted, it started to really focus on people that were younger and younger. And so within the African American community, we can see that I mean, that's kind of frightening when you're talking in your 40s, winding up in terms of hospitalizations and deaths. So with that, I will unshare my screen, and if there are any questions.
Right. I know we have a few questions, or a couple questions for Dr. Park, but before we go there, I'll just open it up for anyone that might have a question for Mr. Davis.
This is Edmund Green. Mr. Davis, how do you determine everyone's income when the shot was free? And my second question is, on the second shot at Kaiser, the line was very long. It was awful long lines, and people got frustrated and they left on that. And during that time I was there, it started raining too. And so people got frustrated, but now it's available where the lines are not long, and I guess people just don't want to come back. That part there, getting a second shot, because I almost didn't get my second shot because at Kaiser, the line was all the way around the building, and my appointment was at 1, and I didn't leave there till 3:15. But when it got up, it split from Pfizer to Moderna, but you had a lot of handicapped people that was in line too. So how do you determine the income on the people? We didn't fill out no forms or nothing, just the health questions.
Right. So when you get your vaccine, you have to provide your name, you have to provide your date of birth. And so with your name, your date of birth, and your address, being a data scientist, we can get additional information, and that tells us about the person's race, income, a bunch of other factors. And then my job is to take all of that information and see if there's anything in that data that would allow me to predict an outcome. So I'm not just looking at vaccines, I'm looking at who died of COVID, who got COVID, when they got COVID. And so there are some things that we know, right? The size of your household, if your house is 1,800 square feet or less, which could be tied to your income, but if your house is 1,800 square feet or less and more than 3 people are in the house, you have a greater risk of not only contracting COVID, you have a much greater risk of hospitalization and potentially death. And who knows? It could be just simply that maybe there's more active virus in a smaller area. I mean, that we don't know, right? I don't like to guess, but those are the types of things that we do know, and that allows us to target. It allows us to prioritize and say, hey, we need to talk to this particular group of people, no matter where they are in the city, and follow up with them because we know they're most at risk. So one of the things that we've done in public health is we've actually calculated a score, what we call a CORA score, which is a COVID outcome risk assessment. We've calculated that for about 670,000 people that live within the county. So that basically tells us someone's risk level, what we project their risk level to be if they were to get COVID. But your experience really speaks to the issue that when it was time for the second shot, it was inconvenient. It's inconvenient for anybody to wait in line, for 2 hours or so. So that's one of the things that, clearly, maybe that's one of the things that we can do is figure out how to shorten things, how to put more things or more localized vaccination in certain areas within the community, or work with community partners to make it easier for people to get the vaccine, especially young people. We've got to get the word out to young people because they're the most active, the most mobile, and it is truly a tragedy when someone young gets COVID and never fully recovers. In my case, my stepbrother, young guy, Div 1 basketball player, just the picture of health, got COVID, and that was almost a year ago, and he has lung damage. He can barely go up and down stairs now. I mean, we're talking about a 32-year-old guy who can barely go up and down stairs because he has severe lung damage. Has changed his life, and we don't know, what's coming next. And so, our young people are at risk. We've really got to get this word out.
Okay, thank you, sir.
Kimberly Spring,
Yeah, go ahead.
you have a question?
Hi, can you hear me?
Yes.
Okay, great. Okay, so I guess this question is sort of, I don't know who it's for, but I work for the Health Resources and Services Administration, specifically for the FQAC program. And I'm not speaking on behalf of my job, but just in terms of the knowledge on community health centers. And so what I don't hear in a lot of these calls are, I'll take, for instance, I've sat in on a couple of calls with community health centers where I was so impressed, where they talked about partnering with the unlikely organizations. I haven't heard this, but during the pandemic, health centers, some of the health centers, especially the African-American health centers that serve a high African-American population, have actually indicated partnering with organizations like the National Panhellenic Council of Greek Organizations, the NAACP. One organization impressed me when I said they partner with the Links Incorporated, in terms of really partnering with those organizations to kind of gather to say, what is it that our community needs? And that's not what I hear in these conversations. I hear El Castiglione, I heard the doctor mention a few organizations, but there are a lot of community, whether it's Black or brown community-based organizations that are out there in the community providing services to the same population that we are talking about today. And I see us working in our silos instead of really a strong unity partnership. And, I have to say, Dr. Park said, what is it that, I'm looking for your help, but at the same time, I'm like, well, how do we gather as a group and talk with Dr. Parks to say, what is it that's needed? What is it? Do we need to get trained so we can get our tennis shoes on and get out in the community. I don't know what that looks like, but what I do see is all of us working in our silos, and I do not see all of us partnering. Again, I work for HRSA, and to hear health centers now talk about working with these organizations really impressed me. And I was just like, oh my gosh, I have to say something to someone to really, that they're actually partnering with these organizations that one, I'm a part of, but also just wanted to figure out next steps, because we keep talking about this, and how do we bring in our FQs? How do we bring in our other organizations? How do we start talking? How do we get the word out? How do we, because we all see this, we all touch the same population.
Thank you for that question. And that's exactly what I meant, is that we need to do that when I was talking earlier about how I need help. I'll tell you what El Concilio has done, and maybe we can model something for the African American community on what they've done. So they have a meeting every other Wednesday with the FQHC in town, CMC, and they invite
Very much
Catholic
aware of them.
charities. Yes, they invite Catholic charities. They invite some Catholic pastors, Hispanic, Lutheran pastors, and they get on these meetings and they say, look, CMC, now CMC is not part of me. They're a federally qualified healthcare center. They don't even get their vaccines from me. They get their vaccines from the federal government. I have nothing to do with giving them vaccines. But see, this is what El Concilio did. They started partnering with CMC.
Yep.
And CMC gets vaccines from the federal government to vaccinate homeless and farm workers and to focus on those groups. But what they do is they set up a church. For example, today, I think, or next week on the 22nd, they're going to be at St. Mary's Church in Stockton. What El Concilio and Catholic Charities and all the other Latino groups do is they say, okay, they're going to be at St. Mary's from this hour to this hour. El Concilio is going to fill up this 1 hour with patients because they can do 15 patients every 30 minutes. Catholic Charities, you fill up this hour. This organization takes this hour and this organization takes that hour. We found the place, we found the church. We're going to set up the chairs at the church. We're going to make sure the church is open and we're going to advertise it. They put it all over social media, Facebook, and they push it out, push it out, push it out, and invite people. And that's exactly what they've done. And it's working for them. So that's the kind of partnership we may need at some point. Oh, my child just came back from swim practice. But that, you know, if we have a relationship with a couple of organizations in our African American community, we can do this without CMC. Public health can go and be your vaccinators. We've got other vaccine teams. So this is the kind of thing I'm talking about setting up. And not only do they set up the events at St. Mary's, but we'll say, hey, we're also going to be at the Lodi Street Fair tomorrow. That's not their event, but they write it down. They take our flyers and they push it out, push it out, push it out. They push it out on their own websites and on their Facebook page, their Instagram page. And we tell them where we're going to be. And they sent people to Kaiser and they educated themselves about the Johnson & Johnson vaccine. And then they went and talked to people about it and told people, go to the Kaiser Mass Vac site. So they ask us for education, we educate, and then they put the message out and they tell people where to go and where to find vaccine. And the other thing we can really work on is the incentivization part, is what do we think we need to do to get people there? What would it take to get people there? But
okay.
Yeah.
And that's, I appreciate that, because actually the county, San Joaquin County, also gets a grant from a community health center grant from HRSA, as well as Valley Health. So there's several touch point community health centers in San Joaquin, including Golden Valley has a site in San Joaquin. So it's a few health centers out, FQACs out there. So thank you for that, and I appreciate it. Thank you.
So let me kind of speak to that a little bit too, because every time that you're here or different doctors are here, we sent out a notice, and I personally sent a notice to the leadership of all of the Black organizations that I know about. And including, I sent him out last night because we got, Dr. Park was able to get Mr. Davis here with us today. And on Thursday, Mr. Davis was not here with us because I had never heard of Mr. Davis before Thursday. And I was elated that Dr. Park talked about having a African-American statistician or data scientist, whatever the proper term is, because it's important that we see folk that look like us that are given this information and answering questions because of the lack of trust. But at the same time, we as African Americans, to a great degree, have to be responsible and make sure that the organizations that we're involved in, it doesn't matter whether it's a 10-person organization or a 2,000-person organization, that they get out, get the information so that they can share it with other people. That's the whole purpose of having Dr. Park here today and having Mr. Davis here today, because the Deputy Director of Public Health said to me on Monday, we're getting, the numbers are going down on African Americans getting the vaccine. We have a problem. They're not showing up for the second shot. They're not coming out. And I've said to them, and we've said to them, that you need to go into the community. You need to provide transportation or work with us to provide transportation to get people to where they can get the vaccines. But more importantly, send some folks out in the community, giving the vaccine to people that can't get out. So, and I'm saying we also cannot make excuses for us not reaching our people and carrying this message, because we are the ones that need to carry the message, and that the message is trusted in coming from more so than Caucasians or any other non-Black people. We also, coming up, I did talk with, what's her name, Shadi, on Monday, and I told her that there's going to be a Juneteenth festival where there will be some Black folk there. And in my conversation with Gloria yesterday, she said that they're working on that and public health is going to come. So while public health is stepping up to the table better now, it's, for the most part, public health has not stepped up to the table as it relates to the Black community. And as I've said to Maggie, and I've said to others, that you need to hire some Black folk and have them go out into these communities and talk to people, because you got money, you know, and the commitment is what I've questioned in terms of actually reaching into the Black community. Most of the public health programs that I've been associated with over the years have been dwindled down to little or nothing, versus 10, 15 years ago, there were a good number of programs, but you also had a Black person in the public health department at a level that would go out and push the AIDS program, would go out and push the child mortality program, those kind of things. So if there's nobody in the house at the table that looks like us, then nobody else is going to think about us, because generally we will become an afterthought. And I'll shut up.
I would like to add on,
Yes.
Bobby,
Yes.
can I tell Maggie exactly and the other people on board what we actually do for Juneteenth and our previous activities in the community? What we do, we have caravans going throughout the community, in the underserved communities, like on 9th Street, 8th Street, all of the low-income housing. We pass out flyers. We give valuable information. We did this for the census, and we're getting ready to do this for the Juneteenth Festival, advertising that we will be giving vaccinations and testing if possible. And the people, when we go into these communities, the people open up to us and they listen to us because we are proof that we did all of these things, and they want to know how they can get to the area where we're at. And it always did work for us. And we're getting ready to do another caravan for the Juneteenth Festival, providing information about vaccines, showing them how important it is to get the young ones out. And we also providing activities, free activities for this event, where the youth can participate in the events with poetry slams, music, and any other valuable thing that they can do for this event. And we putting this together, structured, getting the young folks to get vaccinated, talking to the parents, letting them know that it's important for the children to get vaccinated. And we know it's going to work because they listen to us. And it's been proven because we did the census and the numbers increased when we went into the community. We did caravans every weekend. We rode around the community, went to the grocery stores, we provided flyers. We gave them all kinds of information that was valuable for them to fill out the census. And this was the best census we ever had. So I'm just letting you know that going into the community really, really worked. And we're going to do this again for the Juneteenth Festival for COVID vaccinations, etc.
Thank you so
All right.
much.
Thank you.
We hear
So,
you
Doc-
loud and clear. So, oh, did someone else have a comment?
Yes, actually, I had one particular a comment, and what I'm listening to is that yes, this is irrelevant. It's very important, but are we taking in consideration the signs that is happening around the world, especially what's happening in India? At one point in India was not as severe as it is now, and due to what they're dealing with the shortage of having oxygen and the rise of the deaths due to COVID. In respects to what's happening here in the community, are we becoming complacent in the sense of, people who have been vaccinated, we're relying on them to provide a herd immunity? Is there a sense of illusion that amongst the young people, especially in my own personal household, I have a daughter who was not vaccinated, but her mother had contracted COVID. Her son contracted COVID. But as I said, my younger daughter, she did not. And when I asked her and I said, hey, are you thinking about taking the vaccine? And she says, well, if it comes up in conversation, I'll give it a thought. And see, this is what concerns me. There is not, for myself, I've done this, I've done the shots, I've done both of them. And there was no hesitation, and partly because my daughter that I'm speaking of is has immune issues. So I want to make sure that I protect myself and give her an opportunity to know that she's safe around me. Not that she's not safe around her mother or her brother, but here we have a thing of what makes it attractive to younger people, right? People of color. Are we going to the schools? Are we going to the places where they hang out, where they are? A lot of them are in the house, and how that communication is relied to the parent, because that's where the child listens to. They listen to their own peers. When I was coming up, I didn't listen too much to my parents, but it was mostly my peers. Who did I listen to? Who did I gravitate to? And how did they convince me to make those choice decisions that I made? And so the question relies, and that has not really changed too much, where today kids listen to kids in that community from 16 to, I would say, 25 or older. They're communicating through music. They're communicating through whatever social media that they rely on. And is that being pumped into saying, hey, look, if we don't get control of this situation, we're faced with something that people are not prepared for. What we have just went through in the last year, unfortunately, that would be, I hate to say it, but that would be mild compared to what could come, especially with the work that Mr. Davis is doing. Yes, I take my hat off to you as well as Ms. Parks. What concerns me is, are we becoming more complacent and not more motivated in doing something in a sense of yesterday as opposed to tomorrow.
Thank you, Mr. Oriella. We'll let Dr. Park maybe respond to the complacency, and then we have a couple of questions in the chat that we want to get to.
Yeah, thank you for all of those questions. I mean, myself, public health, we're not becoming complacent. We're trying to up our game because we have to now. We're pivoting into a time where we're needing to reach people who don't have that sense of urgency to get the vaccine, the wait and see approach, the young people who say, I'm not against getting the vaccine, but I'm not going to make the appointment today. I got something else to do. So yeah, from a public health side, we are definitely not complacent, but are we worried that the general public is complacent? Yes, we are. And are we, I mean, I don't think we're going to have anything like India happening in this country, but do we have variants? Yes, we do. And is the India variant in some parts of this country? Yes, it is. And we know that we have variants that are more transmissible than the original wild type. And that's a concern. And so, you know, here we've got a mixture of people who are complacent or just not compliant at all. And then we've got the political side of things where the state needs to open up because of political reasons too. So we're just fighting all of that messaging and trying to make people understand the science still tells us COVID's a risk. So be careful. Maybe you're going to hear that you don't have to wear your mask anymore. Fine. That's based on science, because if you're fully vaccinated, and we really believe the vaccine is great, it works. So yes, but don't go being stupid and take your mask off when you're about to go to this big mosh pit at a big music festival. Just play it smart. And there's things you can do to continue to mitigate. So we are working on that. Now we're pivoting towards testimonials to try to overcome complacency. Young people, we know they listen to music, TikTok. We're talking about TikTok videos, competitions between high schools to do TikTok videos. We're trying to be creative. This is a place that public health has never gone before. We're not public informations people. We're not media relations. We're public health. So we're using people who are usually health educators, and all of a sudden they're social media people. So we are looking for help. We're trying to tap into talent at public health and people who aren't actually hired to do that kind of work, but who have that kind of talent. So we are trying to overcome complacency. I want to go back to Juneteenth and Mr. Bivens's comments. We're going to be there at Juneteenth. We are happy to be there. And I know, Mr. Bivens, we don't have a lot of African-American faces in public health that are out there. They're not really part of the COVID vaccine team per se, but we've got a lot of staff who are African-American. So like Valentina Pig, who's on the board for Juneteenth, she's getting us organized and to be there at Juneteenth. And we're already committed to taking our vaccine there. If you're going to do canvassing with this caravan, Gloria, we'd love to talk to you more, because we would love to have our health educators talk to the people who are going to be in your caravan to tell them, teach them how they might talk about the vaccine so that more people show up on Juneteenth. I would love to have our health educators talk to your team that's going to be caravanning, and we could even tag along if need be. We have Sandy Merriweather at Public Health. Again, not on the vaccine team per se. She works in maternal, child, adolescent health with our Black Infant Health Program, but she set me up to talk to the Ministerial Alliance of Pastors. About a month ago, I talked to 35 African-American pastors. That led to them wanting an event, and that event didn't end up happening at a church. It actually ended up happening at Ralph Lee White's house. But in any case, we got an event together, and we got some people vaccinated based on us talking through Sandy to some people. So I know what you're saying. We need more faces that look like you all, and I hear you loud and clear that you want us out there really doing that unique messaging to the African American community that maybe you haven't seen us do. So whatever ideas you have, I'm really, open-minded and open to hearing what you think you can do. And with Kimberly talking, when Kimberly was talking, I was thinking, that's El Concilio has done this. That wasn't me though. That was El Concilio working with CMC, but I've got vaccinators. And so if Kimberly, if you want to put your information in the chat, I'd love to talk to you more about maybe organizing something like that, like the way they've been working. So anyone want to put information in the chat, we will reach out to you.
Bobby, can you share my information with her? I'm driving. Just send her a private text or something.
You're muted, Bobby.
You're muted, President Bivens.
He's muted, but I
Oh,
think he's saying yes.
Yes, I can, and yes, I will. And I think the other side of that is
Thank you.
only week before last have we had any interaction with CMC. And for almost a year, literally, I have been trying to reach out and have a conversation with their executive director, including going to their office 3 different times, leaving my business cards, leaving brochures on the NAACP. And only when I spoke at the Community Health Leadership Council Friday before last did I get a reach out from her. And I called a number of times and left information. So it also has to do, and Kimberly's on and has some impact, that these community health organizations are negligent in their interaction and collaboration with Black organizations. You know, you got Geneva, she was formerly a public health employee that did a lot of things around AIDS and HIV and diabetes and those kind of things. Well, they didn't, she's not gone, but we also have a Black nurses organization that are here in the community that could be engaged and assisting in some kind of way. They have medical background, you know, so those are some ways of getting people that look like us out there. I mean, I think in a 20-hour conversation or education program, you could train some people or some young people or any Black people could be trained to talk the language of getting people engaged in getting the vaccinations. So it's a matter of how flexible you want to be. Now, I hear you, Maggie, and I hear you saying that you guys are now being far more flexible than you've ever been before. But for us that are out here as advocates, it's, you know, we have to accept the fact that you're here now, and we can't beat up on the agency for what they didn't do in the past. But certainly the opportunity table has to be spread around a little bit. Elk and we partner with El Concilio, you know, so, but again, their focus is on Latinos. Most Black people feel that there's a major focus on Latinos and none or little on the Black community. Now I'm saying it because I hear it all the time. And it in you all's mind, it may have to do with the numbers. In our mind, it has to do with, again, some levels of discrimination.
Understood.
Bobby, this is Kimberly. I think there's an opportunity, so definitely we will be in contact with one another, and as well as with Dr. Parks.
Oh yeah, absolutely.
Okay.
I want to make a quick point.
Dr. Park, just a quick question. So with respect to the, you know, I know Mr. Davis showed some of the challenges that we have with folks being concerned that either they're not going to get the second shot or they're going to miss time off because of they got to come get a second shot. Is there an opportunity to, or are we prioritizing the Johnson & Johnson single dose vaccine for the community? Because so that it, you know, we can maybe if they're hard, if they don't want to come get one shot, it's going to be hard to get them to get two shots. So maybe we can get them to get that single dose. And do we have an opportunity to get like a greater share of that to come to San Joaquin County for that purpose?
So yeah, happy to answer that. Chuck, did you want to say something? I will answer your question about Johnson & Johnson.
Yeah, I just want to speak to Mr. Orr's comment earlier about complacency. You know, he's absolutely right. You know, there is a certain amount of complacency, right? Because psychologically, everybody just wants to put this past them, but biology doesn't work that way, right? I mean, we know this. COVID's not quite done. So one of the jobs that I have working with the county is to make these predictions based on the data. And Dr. Park and I have spent many hours wishing that I was wrong on a lot of this. And unfortunately, we've been right more times than we've been wrong. So what I wanted to do is I just want to kind of just be real and lay it on the line for folks. We're not going to eradicate COVID. COVID's here to stay, first and foremost. And this is important because I think that in terms of outreach and protecting our community, we need to look at short-term things that we could do, like Juneteenth, and we need to have a long-term strategy, because this is now going to be a long-term problem, just like diabetes and other things in our community, hypertension. Now we can add COVID to the list, and we need to have a strategy for how we're going to deal with it. And it's going to affect our younger population. So that's the first thing. We've not eradicated a disease. Mankind's only eradicated one disease, smallpox. That's it. We're not going to get rid of COVID. It's a coronavirus. It will become what we call endemic. It will change, and we'll get better at dealing with it, but it's here. Secondly, the data. You don't need to be a data scientist to look at my numbers and see what's gone on in terms of the vaccine. When I tell you that the upper income, based on the data that we were able to absolutely verify, when I took my mom to get her vaccine at a vaccine site, it was all Mercedes and Lexuses and Teslas. So rich white folks made sure that they got their vaccine. And, it's one of those things where you have to ask yourselves, we're so hesitant to get the vaccine, and, there are a lot of rumors, and I don't trust the government, I don't trust this. But at the same time, the people that had the most to lose, they made darn sure that they got their vaccine. They were lying to figure out ways to get the vaccine. And here, we're trying to figure this out. So I agree. I think especially with younger people, and like Mr. Orr was saying, yeah, we're becoming to a certain degree complacent, but we can't let off the gas. In fact, we need to mash the accelerator right now, because while there is this sense of complacency, this is the opportunity, while there is lots of vaccine and there's an emphasis for us to best protect our community. Personally, I just think that we need to have a comprehensive strategy for how that happens. I can't speak to public health in the past, but the fact that Dr. Park is here on a Saturday, the fact that I'm here, and personal commitment, I will continue to be here, whatever data is needed. I mean, we know who these people are that have got vaccine. We know who these people are that have not got vaccine. And so, which is unprecedented. There aren't that many counties that are in a position to say that. So there's no question that there's some very targeted outreach that we can do. And, we will partner to do that with the data. And I think that Dr. Park has more than made the commitment to figure out how to best do that. So again, to Mr. Orr's point, the point that I want to make is, yes, there is a sense of complacency, but I think within that sense of complacency, that's the pocket, that's the opportunity for us to do something that could be monumental, I think, in this county with the leadership that's being demonstrated here today by the NAACP.
And we certainly intend to be a part of trying to bring some solutions, and that's why you're hearing some of the dialogue. We have some other health professionals on here, retired and or consulting, that also have a lot to bring to the table. We're talking about health equity. And this is the health equity issue right here that we're talking about. because we need to make sure that Black folk, and see, we can't, that's part of the problem. See, we want to be nice and not call the problem that we have is Black folk, and just flat out say Black folk are dying at a higher rate, and that we need to have Black people understand without a question that your family members are at risk. You may not be, but your family members are. And I don't think that we have put that message out hard enough, strong enough, and to the degree that it's staying in the minds of people, because now you have people, you got the shots and people are going out, and then you have the confusion. And that's what I'd like for you to address, Dr. Park, the confusion of the CDC saying you don't have to wear a mask in public anymore, or that it's okay. And if you're young, you know, we're gonna give shots to your babies, and folks are really afraid about their babies getting the vaccine for the long-term effect. And a lot of young people are concerned about the long-term effect because it's not really been explained to them. And again, you have all this social media rumors that are going on. But in the state of California, the law has not been changed to tell people to take off the mask. So somewhere we need to have a advertisement that says CDC says no mask, but the California legislature says mask, and it's still illegal to take off your mask in California. And so, and I know it's political. I clearly understand that right now the governor is succumbing to the pressure, and especially when you add on the piece of a recall. So, you know, I'm kind of feeling like, you know, some of what's going on in the opening up is to take some pressure off of the governor's neck. And I'm not so sure that the governor is all of that in love with us, although he's done some things that other folk have not. But we're also at a different time than other folk were at previously too. So what about the mask and no mask?
Thank you, thank you. And I'll go quickly back to the Johnson & Johnson question. And basically the answer is we are continuing to offer Johnson & Johnson. But a lot of our events, we have 2 vaccines. So people have a choice to get an mRNA vaccine and come back for a second, or get the Johnson & Johnson and be one and done. So we're kind of taking all the vaccines on the road now. Thank you for the question about the masking, Mr. Bivens. What people don't understand is that the CDC is a national, organization, as you might say. Obviously, we respect what they say. We believe that what they say is based in science, but it doesn't mean that as soon as CDC says something, that in the state of California, it's allowed. So yes, the CDC said, take your masks off. Here in the state of California, our masking guidance still says fully vaccinated people can take it off outdoors if they're not going to be at a crowded event. So there's some allowances for taking your mask off. There are, but we haven't gotten to the point where we've lifted it completely. And so people need to understand that we wait for the state to make a recommendation. And right now the state's looking very carefully at what the CDC said and trying to decide whether to align with it completely or whether we would like to err on the side of being more careful. This state's been very careful throughout this pandemic. And I will tell you, that is why we have landed in a spot right now where we have the least amount of cases in the nation. And we're really doing well as a state. So some of that carefulness has led us to being one of the states in the nation that's doing very well. When the CDC comes out with new guidance, the scientists, the experts, the doctors, they all look at it. They talk to counties, health officers. And so we don't immediately align with the CDC because there's a lot of back and forth, a lot of everyone respecting everyone else's opinions. There's conversation. And then if we do end up changing the masking guidance at the state level, that also has to go through, lawyers and other folks. So it might be a while before we align completely with the CDC, but in general, the goal is usually to try to align. But you're right now, so far, we have not put out any official guidance from the state saying that we're changing the most recent and last update to the masking guidance. So we're status quo right now until further notice. But thank you for bringing that up.
Are there other questions in the chat, Najee? Or anyone have anything?
Yes,
Any
we do have a
questions?
couple of questions. So the first one here, maybe Dr. Park can put in into the chat the webpage. I think it was that you were speaking to with Dr. I think it's Nadine Harris and her information. So one of our members wanted to get that webpage. And the other question is respect to booster shots and the future need for booster shots. And so the question is, if you could talk about that, whether or not they're coming, and if so, when, and if there's any information about how that might be rolled out.
Well, I don't know when they're coming, and I don't know whether they're really going to be needed. So the science is still out there, and we're still tracking cases and we're tracking variants. And I know that there are some medical experts out there who say, oh, Pfizer, Moderna, they're coming out with these booster shots. But just because they're creating them doesn't mean we need them. Some of this is commercial too. So we're going to wait and see. We're going to look and see. I think likely there will be some booster shots. It's like Chuck said, this is going to become endemic, not pandemic. It's going to be with us for a while. And so, yeah, I do believe in the end, those of us who've been vaccinated will need to get another vaccine at some point. But I can't say for sure. And I can't say for sure that all these fancy new shots that are coming out that supposedly cover more variants are going to really be needed. That we're going to follow the science and we're going to follow what the CDC says on that one. So don't know yet. That's a good question though. And I can't tell you, there's no timeline yet on that.
The Kimberly Range has her hand up.
Yeah, I guess this is probably a little bit more for Bobby. When it comes to we talk about health equity and who's getting the vaccine, and the discussion that I had earlier, just know, and I can send you some information, that the vaccines that HRSA is providing to community health centers is to specifically address health equity. And so, health centers every week have to report in those numbers. And so if you're indicating there's an issue with health centers really getting into the African-American community, then that's a conversation that needs to be had, because those vaccines that the federal government or HRSA is providing to health centers is specifically to address health equity.
Okay, thank you, Kimberly. And we will talk some more offline.
One
Back to you,
last
Ned.
question here, that came in. So, Dr. Park, do you believe that some of the complacency or the lack of pursuit of the vaccine is associated with the June 15th opening date? And so folks feeling like there's some confusion there, I guess, in some of the messaging that things are okay. And so people don't want to are not moving forward. And if that's the case, is there do you anticipate any changes to that date if things don't get better?
Yeah, that's a great question. I certainly think that there is some complacency related to the June 15th date. And it's kind of backfiring on us. The governor said June 15th, we'll open if you all get vaccinated and if we have good vaccine supply. So that was supposed to be a stimulus to get people back to vaccinate, saying, okay, if we have enough people vaccinated, we'll be able to open on June 15th. But people heard that and said, oh, it don't matter. We're opening on June 15th. COVID must be going away. By June 15th, we're going to have low enough rates of COVID. I don't have to worry. So maybe I don't need to put my body out there and my arm out there for this effort. So yes, it kind of is working against us in a way. Same as the CDC masking. The CDC saying, hey, if you get fully vaccinated, you can take your mask off. It's like dangling a carrot and hoping that people will say, ooh, I want to be able to visit with my friends and my family and go to concerts and festivals and fairs, and I'm going to get vaccinated. That's the goal, is to say, if you do this, then you get that. But hopefully that doesn't tell people, y'all can just take your masks off and stop washing your hands and stop distancing because it's going away. Because as we've already established it, it's not. So yeah, there's some problems with setting dates and some problems with the way people interpret that date. Of course, people are complacent for a variety of other reasons as well, but that I think does have a factor. Thank you.
So Dr. Parker, you all out at the asparagus event at the county fairgrounds giving shots this weekend?
There is a public health team out there right now, and they'll be there tomorrow again. So yes, we're out there vaccinating. Again, that's another event that's got both the Johnson & Johnson and the Pfizer. So it's get which one you want, whichever one you're comfortable with. We're trying to do that. And we got enough of each kind of vaccine right now. So there's no lack of supply right now.
Any other questions or comments? Connie, you have anything?
One thing,
I have been listening to all of this, and my plan is that I am going to get involved with some of the community-based organizations. And so we'll get something going, and I certainly will also reach out to Dr. Parks, and we're going to get some things going.
thank you. And I'm not trying to say that there's other organizations ahead of the game. Some of these organizations we've been talking about are well-funded. They've got the grants, they got the money. Let's be honest here, right? They're flush with cash, and that's why they've been able to move forward. So I'm not trying to say, oh, this group's faster, this group's slower. This is but the timing for this conversation is perfect. So, I don't believe we're too behind the game here when it comes to other agencies, other organizations. And I'm happy to work with you. I will say at Public Health, we made a huge effort to hire nurses to be vaccinators. And people don't understand how hard it is right now because there's such a market for nurses, and they're going to go work at a hospital and get paid a lot. So we tried to hire big teams of nurses, and it was hard. So that's probably why you don't see us out there a lot. And we didn't really get out there and make ourselves like publicly available and in the news and in the press. And it's really now that we've put together a small team of nurses and we're pivoting to this ground game. I think the timing is perfect because we're now hitting this point where we're reaching the vaccine hesitant people. So happy to work with you, Constance, Kimberly, Gloria. Reach out to us. We would like to know if there's any other CBOs out there that focus on the African American community. We know it's not just the NAACP, but there are others. So because we don't know them all. So if you tell us who else are the big players in this effort, we could link up and try to do something. I would love to have a list if you have one.
I appreciate that.
All right. And I did want to say that our ladies that are, and I don't know if it's any men in the organization, Chi Eta Phi, which is the nursing sorority. So sorority, I guess, indicates there's no men are in it. But at any rate, they are experienced but older, so I suspect that probably some of them that would maybe want to volunteer are also in the vulnerable group as well and not willing to take that risk, and I can't blame them. But at the same time, do you really have to be a nurse to give a shot? I mean, can't some folks be trained within a 40-hour or a 60-hour course to be able to give the COVID shots? and employed for an emergency basis. You know, when we have emergencies and disasters, all the rules go away. So we get to do things that normally we couldn't do and be creative. So what about that, Dr. Park? Do we got to go and pull Mr. Patty off of the pedestal to get this done, or what?
There's a long list of people, occupations that are allowed to give the COVID shot. The state has released lists and then updated them. And medical assistants, nurses, nursing students with supervision, EMT paramedics, so doctors, obviously, pharmacists, dentists. So there is a list of people who can give it. There are trainings for nursing students to try to get some of that experience under their belt enough to become vaccinators. So thank you for that question. We do have teams that we work with that we can send out, various teams. Yeah, we could always use more vaccinators. This is true, but at this point, we have several teams that can be deployed to your business, to your church, to your function, if you'd like to organize with us.
Okay. All right. Are there any more questions?
I just have one question. How are you all vaccinating the homeless people? I've been to Lincoln passing out flyers and COVID material to the homeless people that I was unaware of in certain areas. And it's a mass population of them in these areas. How are they being vaccinated? Because it's interesting to see that they're not aware of what's going on. And when you tell them about these things, look like they, they want to know more, but I don't know if they respond to what we tell them to do. So are they being vaccinated?
Thank you. So we did have homeless task force meetings every Wednesday at 9 for a while. And then the vaccine got approved for homeless and we started in on some of these groups. But I will admit, harder to get to those who are in encampments, but we've done the shelters. So Joan Sing Song from San Joaquin County Clinics was in on those meetings, and we arranged for the Stockton Homeless Shelter, Gospel Rescue, Salvation Army, the different groups in all the cities to take their turn. And she went out with her vaccine team and got them done. And prior to the residents who stay overnight getting vaccinated, we also vaccinated the staff. So first staff got vaccinated, and then residents. So that effort's there. We do have connections to homeless encampments through some of our outreach workers who do tuberculosis. We do talk with our mental health partners who know a lot of these folks. And we are looking at partnering with some groups to see how can we get to them, how can we do something close by to where we know people have encampments and educate and bring them in. It's going to take some more effort, but we are looking at that. So you might see that happening, but we've done the shelters. Thank you.
Thank you.
Okay, so we are at 5 minutes before our closing time, and I want to thank you, Dr. Park, as usual, for your participation and information and taking in input and trying to make change in our community, and in particularly the African American community. And you know my saying, if the African community gets help, then everybody else is automatically going to get some too. So thank you, Mr. Davis. Thank you, sir, for being with us. This is your first encounter with the Stockton branch NACP. We do urge you to come to Stockton. We urge you to join our branch along with everybody else. You too, Dr. Parker. We want you to become a life member since you saving lives. But thank you. Thank you. Thank you. We really appreciate it. And certainly we will invite you back. There's pieces of what you were doing that I think we could present to other groups or a united group of folk so that they understand where we really are, including some kids, because there's going to be a summer program for high school age all the way down to the 4th grade. And we need to give some of this information to those youngsters and help them to understand, to go home, to take the message home, because that's just like in school. They get a note to take home, and some of them take it home and give that information. And I think we need to target young people and come up with a presentation that's focused on youngsters. And we'd like to have another conversation with you if we could, and give you time to think about how we could do that and get that message to some of these kids. If you're willing, and I see you shaking your head.
Oh,
yes.
definitely. Definitely willing. We can have follow-up meetings between whatever team you've got and our team at Public Health and get the ball rolling. You know, we've done a lot of talking now. So, you know, now it's time to really partner up. So I'm really happy that you gave me this opportunity to talk again to this group. We're willing to move forward and get some events together, get some educational materials out there, whatever you need. But thank you for the opportunity.
Thank you. And you said, don't be messing with your consultant. I got the message.
Don't be messing with my Chuck.
I heard that loud and clear. Anyway, can I have a motion for a 10-minute or an 8-minute extension of time?
President Bivens, this is Brandon Thorne. Would like to request a motion for extended meeting to 8 minutes.
Okay, is there a second?
This is Najee, I second.
Okay, thank you. All in favor, vote by the sign of aye.
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 Okay, so we will go 8 more minutes. Thank you. Thank you both so much, and we'll see you again real soon. And I'm glad that in a good way that Dr. Dubois didn't make it, because we got to have all this dialogue with public health. So thank you again. Look forward to seeing you soon.
Bye-bye. It's an honor to be here.
Okay. All right, we have a couple of items that I need to bring to you. One, the branch was requested to perform the prayer, to give prayers in the National Day of Prayer, which was on May the 6th, but on May the 4th, we had a team of ministers that started with our Religious Affairs Chair, Reverend Green, and we had 4 other ministers.
Matt, be quiet.
Black ministers. So Reverend Green, you want to give me about a 30-second on that? And I want to say before he starts, this is the first time in San Joaquin County government history that they ever did recognition on National Prayer Day. Go ahead, Reverend Green.
Yes, thank you, President Bivens. Yeah, this month was National Prayer Week. It's National Annual Prayer Observance, which every first Thursday of May, that was that they would observe that day as National Prayer Day. And the NAACP was invited to the Board of Supervisors, and we was the first and we was the only entity or branch there to help put on the National Prayer Day. And so it started in 1952 with Harriet Truman, and it was July the 4th with him, and then when Ronald Reagan was in office, he moved it to May the 1st. But on the 4th of May, we had National Prayer Day here at the San Joaquin County of Supervisors, and we had they had invited the NAACP Religious Affairs Committee to participate. And those that was in participation with us was Pastor Sappho, Greater Maranatha, not the Church of God in Christ. He prayed for the political leaders, and Pastor Patrice McCullough of New Covenant Tabernacle Church, she prayed for health and wellness, and Bishop Damon Bridges, Restoration of Life Ministry, He prayed for the military, the men and women. And then Pastor Nelson Robel of the Evangelical Lutheran Church. He prayed for the city, county, state, and the United States government. And Reverend Green, the Religion Affairs Chair, prayed for the political first responders and the frontliners. And we had an awesome time, and the supervisors, they presented NAACP with a proclamation, as President Bivens called it, the resolution. So they did present us with a proclamation on that day. And it was awesome. We had a good time. Everybody, all the religious leaders here, the pastors and bishops that said that they would come and participate, everyone showed up and we was there and they was proud. And it was the first time that San Joaquin recognized the National Prayer Day here. And so as President Bivens said, our executive meeting, it was historic for them and for us to kick off the National Prayer Day here in San Joaquin County. Thank you, President Bivens.
Thank you, Reverend Green. Also, I'd like to have I'll share that I spoke at the, and I said it at the executive committee meeting at the Community Health Leadership Council, which is a collaboration of the medical providers in San Joaquin and Stanislaus counties. And as a result of the presentation, now CMC, Community Medical Centers, we're going to meet this week and talk about how CMC can partner with the NAACP. As I said, I've been reaching out to their CEO for over a year. And finally, she was there at the table when that presentation took place. So then she called me and wants to meet this coming week. Same with the San Joaquin, Healthcare San Joaquin. They are going to be working with us on the health equities piece. And there's two different sides to it. We have our health committee, and then we're going to have a task force to work on the health equity piece, which is separate from all the other health issues, trying to get more Black doctors, more Black nurses, more children into thinking about medical school, starting at the 4th grade. So we have a short-term game and a long-term game that we'll be dealing with that. And our health chair and I will be meeting quickly to get to talk about that, because I'm driving in her lane. So I'm gonna get out. The next thing is that just coming June 1st, we'll have the city manager's oversight committee on policing will meet. So if anybody wants to give me any input or share any thoughts, ideas, or recommendations before I go to that meeting, I'd love to hear it. I did hear from Chief Jones when the police officer got shot, also with the gentleman that did the shooting. Certainly we're in condolence, and I expressed our condolences related to the family and the police officer being killed. So that's important. And next, I want to tell you that we have requests from Public Health Deputy Director to assist with COVID shots in the Black community. And so we're going to talk about how that can happen. And as I was saying during the meeting, they have money and they have ways, and we can come up with ways to make this get done so that we stop dying at the rate we're dying. And when I'm saying we, I'm talking about Black folks. Next item was the state conference, NAACP state conference is also going to be putting out some money. The governor had met with our state president and talked about putting some money out with all the branches between $1,000 and $10,000 to do outreach work related to COVID. And the state conference will determine, I already said we're interested, and they will make a determination based on capability, how much money each branch will get. It's for a 90-day project. And so lastly, I want to, in the announcement side, first of all, I want to congratulate Najee for being promoted to the Deputy Director of Public Health for San Joaquin County. It's a big department. They do all the construction stuff, and they have lots of funds, but Najee's been pushing that, and he is a force, and I believe it will be a new day in the Public Works Department. It's going to take some time, but it will be a new day and a new way. So congratulations, Najee. I also want to say that sadly, Bobby Jones is leaving us, Deacon Bobby Jones. He's leaving as of June 1st, moving to Memphis, Tennessee. So he says he will hopefully get back to visit with us from time to time, but he is officially moving out of our community. And that's why he's not here today. That's why he wasn't here Monday, because he's packing. So he sold his house and all of that. So we will truly miss him. He's a good brother that's been really a lot of help to this branch over the years. Next is, I want to congratulate Casey and Brandon Thorne. They both just received their their MBAs this past week. And Brandon got his a little earlier. His wife got hers on Saturday. Brandon, since I know you prepared, pop up one picture of you and Casey together so we can all give you a kiss and, and an applause. We kissing her and we applauding you.
During the meeting.
I don't want you to get this twisted.
I'll make sure I let her know. Thanks, President.
Okay. And as I'm talking, and then next, I want to let you all know that our first vice president, Deidre Davey, became a lady of distinction, I guess they would say. And I'm not going to argue that point. But Dee became a link last weekend, and I did attend the virtual ceremony. So I want to congratulate Dee Dee on becoming a link, and I don't want her to get it twisted either and think she's supposed to get in more time than she's giving us. So, you know, these folks keep picking off our leadership, but we ain't gonna let that happen. Connie's smiling because she's a big player in the Links organization at a national level and regional. So Connie, we glad y'all brought Dee Dee on in the fold, but I don't want y'all getting it twisted now. Next is something else. I can't remember what happened. Luana's not here today. You all know that obviously we started late, which is my fault, not hers. But she's in Nashville at our great nieces. Two of them graduated from college this week. One from Bennett, and she was the class president and the valedictorian and speaker at Bennett University's graduation, which is a Black college for women. And with that, Juneteenth is coming up, sponsored by the Juneteenth Committee. Gloria is spearheading that effort. And so certainly we're going to participate and support it and be involved at that event. And lastly, but not least, I want to thank you all for being here today. Somehow I think I probably got the links twisted up. I sent out a bunch and Gloria and Luana sent out a bunch. So I may have threw a wrench into the gears and had a small turnout today. I don't know. But at any rate, we got the information. We need to push this. And so this is another major task and a major opportunity to do some great work in the Black community. So thank you all for being here. Thank you all for listening. Anybody have any other announcement for today? Louise,
put in
go ahead.
I put in the chat regarding the membership renewal. So take a look, anybody that need to look at it, and thank you.
Well, you might as well talk since you got the mic going. You got 30 seconds. Go ahead.
Oh, so we're working hard at updating the renewals and also sending out notifications and working on this brand new program that they have that's supposed to allow us to make it faster and more efficient. So I'm honored to help Miss Gloria, our secretary and the president, get that done. So in the
Okay.
chat is the information you need.
All right, thank you. Any other comments? So to all of you that participated today, thank you for being here. I hope you will continue to be here, and God bless you. And Reverend Green, I need a motion to adjourn since I'm 2 minutes over the minutes I asked for.
President Bivens, this is Brandon Thorne. Request a motion to adjourn the meeting today.
There's a second?
Evan Wade, second.
Okay, all in favor? Oh, I forgot. Thank you, Evan. They're also at San Joaquin Delta College recruiting for Black professionals to become a part of their staff and team. And Evan is our outreach guy on that. So that's the other thing I had forgotten. So thank you.
Thanks for a reminder too. We just opened up a grant writer position as well too. So all the job openings can be found on our if you just put into a search engine, Delta College Human Resources, you'll pull up the full list of jobs. Thank you.
Thank you, Evan. Okay, Reverend Green, you want to pray us out?
Yes, President Bivens. Father God, we thank you for this, another opportunity to come together and meet. And we pray, God, as we disperse from this meeting, that you will go with us, that you keep a hedge of protection around us and our loved ones and all those that we come in contact with. We say thank you, Lord, for everything that you allowed to transpire here on today. We pray, God, that as we leave, that you watch over us as we absent one from another. For these blessings and all blessings we ask us in the name of Jesus, we pray. Amen.
Man, thank you all.
Man, thank you.
And then Brandon, I'll get with you on the recording of today's meeting.